Assalamu alaikum, dear students. This is your lecture of gross anatomy. The topic is pectoral girdle, its muscles, and the fascia. I am Dr. Karimullah, Demonstrator Anatomy Department, GKMC Swabi. The objectives of this lecture will be to know the pectoral girdle, the stabilization of the pectoral girdle by muscles, to understand the muscles of the pectoral girdle, the origin, insertion, blood supply, nerve supply, and the actions of these muscles. The clavipectoral fascia or the deep fascia and its organization, the nerves and blood vessels and their origin. The pectoral girdle or the shoulder girdle. Girdle kamarband, in Urdu. It's a bony ring formed by both of the scapulae, the clavicles, the manubrium of the sternum. The manubrium is the part of the sternal bone in the thoracic region. It has been shown in the diagram by an arrow. It is stabilized by the girdle is stabilized by the pectoral muscles. Now the components of the pectoral region. The bones and joints, the fascia, then the muscles, then the vessels and the nerves. The vessels and the nerves, they will run alongside in the form of a neurovascular bundle and the lymphatics. The bones of the pectoral region, these are the sternum, the ribs, part of the scapula, the clavicle, and the upper end of the humerus bone. The muscles of pectoral region are pectoralis major, pectoralis minor, subclavius, and the serratus anterior muscle. Now the muscles of the pectoral region, one by one. The pectoralis major muscle, it arises, the mean origin, it arises from medial half of the clavicle and from second to sixth costal cartilages. Costal cartilages, in the lower diagram you can see in the ribs the sky blue parts which attached to the sternum bone. These are cartilaginous parts of the ribs. These are called the costal cartilages. The insertion of the pectoralis major muscle is on the lateral lip of the intratubercular sulcus. The lateral lip you will very well know in the study of your osteology of the upper limb. The nerve supply is medial and lateral pectoral nerve. Now the actions of the pectoralis major muscle. The adduction, bringing the upper limb toward the body. Medial rotation of the shoulder. It has been shown in the lower diagram. And another extra function is forceful inspiration. It takes part in the forceful expiration. It is an accessory muscle of the respiratory process. The pectoralis minor muscle, it is situated underneath the pectoralis major muscle. It arises from third, fourth, and fifth rib. It inserts upon the coracoid process of the scapula, and its nerve supply is from the medial pectoral nerve, which arises from the brachial plexus. The action is to depress the shoulder and to protect the scapula, and its accessory function is force. It plays part in forceful inspiration. The subclavius muscle, it arises from the first rib and the first costal cartilage. It inserts upon the inferior surface of the middle clavicle in the subclavian groove. It is supplied by the nerve to subclavius, which also arises from the brachial plexus. Its action is to stabilize the clavicle in the movement of the upper limb. Serratus interior muscle. Serrations or digitations or slips. This muscle arises by mean of slips, and these slips are 8 in number from each rib, from upper 8 ribs. Inserts upon the medial border on the under surface, that is on the costal surface or the surface which is facing the thoracic cage. All the 8 digitations, they inserts from the superior border of the scapula along the medial border up to the inferior angle of the scapula. You can very well see the long thoracic nerve which is descending down upon the mass of the muscle, and this particular muscle is supplied by this particular long thoracic nerve which arises from the brachial plexus. The actions of the muscle are protraction and lateral rotation of the scapula. This muscle is used in pushing and punching process. Sometime during surgical procedure, the long thoracic nerve gets injured. When it gets injured, the serratus interior muscle gets paralyzed. When it gets paralyzed, the patient is unable to push or to punch. We ask the patient to push the wall with the outstretched hands. If the paralysis is there, the scapula on the paralyzed side, the medial border of the scapula wings out, and this is called the winging of the scapula. Now the fascia of the pectoral region. The next to the skin, we find the superficial fascia of the pectoral region. We know the superficial fascia is a fiber fatty layer, and in the pectoral region it contains the breasts of the human body. The deep fascia of the pectoral region is twofold, that is the pectoral fascia and the clavipectoral fascia. Now the attachment of the deep fascia or the clavipectoral fascia. It is attached to the clavicle and the sternum bone. It includes the pectoralis major muscle, the deltoid muscle, and the latissimus dorsi muscle. Latissimus dorsi is coming from the back on the lateral side and inserts upon the humerus bone. Now the uh, pectoral fascia simply invests the pectoralis major muscle, but the clavipectoral fascia is an extension from the deep cervical fascia from the neck, and it invests first of all the clavicle, the subclavius, then the costocoracoid ligament, then the pectoralis minor muscle, and laterally it goes and forms the suspensory ligament. These are the investments of the double fold of the clavipectoral fascia. Now the attachments of the clavipectoral fascia. Laterally the clavipectoral fascia is attached to coracoid process of the scapula. the coracoclavicular ligament, and medially the first costal cartilage and the external intercostal membrane of the first two intercostal spaces. The external intercostal membrane is a membrane which is present in between the costal cartilages on both sides toward the sternum bone. Now, in the upper diagram, you can see the pectoralis major muscle, the cut edge of the pectoralis major muscle. Beneath the pectoralis major muscle, you can see the small pectoralis minor muscle, which is enclosed in a blue line. This blue line shows the clavipectoral fascia. It comes from above, from the neck, the deep fascia of the neck, the cervical fascia, and it encircles the clavicle along with the subclavius muscle, then the costocoracoid ligament, and then the pectoralis minor muscle, and then it forms a ligament, a strong band that is called the suspensory ligament, and it goes toward the pit of the axilla, from the axillary fascia. Now, there are four structures which pass through or traverse through the clavipectoral fascia. These are the lymphatics passing between infraclavicular and apical nodes of the axilla. Second is the cephalic vein. These structures pass inside the clavipectoral fascia. Then the lateral pectoral nerve and the thoracoacromial vessels. These are the structures passing, piercing the clavipectoral fascia and comes outside. Okay, students, this was all about the pectoral girdle, the bones of the pectoral girdle, the muscles, and the fascia of the pectoral girdle. I hope you would have followed me. Thank you very much.